the time I was doing MBBS, because many patients, my mother is also a gynecologist, many patients Malakpet said we used to hear about the Hegde nursing home. So you have done a lot of service for many women in that area, and that's very commendable. And we really congratulate you for moving forward, and I think you've got a good active daughter-in-law who is taking forward your legacy of trying to help women. Yes, definitely. You are very, very clear about women's necessities and needs, and the need to help women to conceive. Definitely, yes. Women's sexual and reproductive rights are so very important. I think all of us should be working very hard to see that every woman is given a sexual and reproductive right. She should be able to decide when she is going to have a baby. She is ready to have a baby, and yes, and if she needs help, definitely give. And when it comes to infertility, I think the times have changed from long time ago, where it used to be the woman who used to be accused of being responsible for the infertility, and now yes, we have advanced where everyone knows that it could be either of the couple who would be at a problem, and that needs to be sorted. I think this sort of social realization is very important, and I'm glad that our country is definitely moving forward. And we always used to think like, yes, infertility is a problem which we need to solve and look into it. And I'd like to tell you all now, recently WHO, I was in the meeting, the WHO is slowly now thinking of making an infertility and disease, so that it could be included in the insurance policies. It would help women to utilize the services when they need. I think that's very important, and these are the changes the world over. Globally, in all the countries, we find that the incidence of infertility is increasing. And I wish you all the best. You seem to have a smart young group, and please take care of women and their rights. Most important is ethical practice, yes. That's one thing I'm sure that my members of Foxy would definitely be working, because I've been told you doctors are not doing this, you doctors are not doing that. But I always believe that my doctors always do the best. Maybe sometimes people are not very happy with us, 1%. It's okay, but all of us will definitely try to see how we can help our women better. Wish you all the best, Vandana, for your endeavor. And I hope that the small branch will also evolve to become a bigger branch. All the best.
Thank you very much, ma'am, for your kind words. Thank you. Is Mrs. Sangeeta Hashika? Not. All right, now I request Dr. Shalini Singh, Consultant Reproductive Medicines, to please step forward for the vote of thanks. Subodhyam, good morning to all the dignitaries and our guests, our colleagues who are present here to bless this occasion. And I take this stage to thank Dr. Vandana for giving me this opportunity that I'm standing here and speaking in front of all of you. And she's the one who has groomed us. And from all the ladies and the women working at Hegde Hospital, we extend a special thanks to Dr. Vandana and Dr. Prashant Hegde for giving us this opportunity that we have grown into a 5th center. Please, a big clap for her from the Hegde family. And Dr. Shanta Kumari said these words. I would just like to extend from a fertility specialist point of view that we are entering 21st century. 21st century belongs to India, and we, the women of India, are contributing a great part to it. And that's why many patients who are coming to us, they think that when they take fertility treatment, they won't be able to work. But from Hegde Hospital, I would like to send this message that we encourage all our patients to continue working, continue to contribute to their organization, to their home. I mean, never ask them to take off or take leave and stop their work. And second thing I would like to say is that after fertility treatment, many patients think that they will have to have cesareans, but as a doctor, as a fertility specialist, I would like to send this message that all women who have conceived through IVF can have a normal delivery. So that message, if reaches to the society, I think more and more patients will be willing to take the correct treatment. Thank you. Thank you so much.
I just want Dr. Kumari to do one small thing that today we are announcing the clinical head of Attapur, Dr. Shalini. I want Dr. Kumari to hand over the... I would like to invite Dr. Jasmine to take over as clinical head of Malakpet branch. Good luck, Jasmine.
Thank you so much.
You've always done that, but it's just a formal. I would like to invite Dr. Lavanya to take over as clinical head of High Tech City branch. Yes, she was a Kannada.
I know as Srinivas is right. I'm just thinking he's in same Lavanya. I don't know about Kannada. I know her as
There's a lot different.
Thank you to all the three who have been a great support for me.
Thank you very much to do the honors, ma'am. I think this is the end of the formal part. Thank you so much once again, ma'am, for being over here and making this day very special for us. All right, in a few more moments, maybe a couple of minutes, we are going to start a press launch. You can have a Q&A with our leadership. It'll just take 2 minutes for setting up the entire stage for you. And once again, ladies and gentlemen, can we make some noise for Dr. Kumari for being here? Thank you so much, ma'am. And once again, I think I would like to welcome our friends from the media. Thank you so much for being here. And we'll take 2 minutes more for setting up the leadership for you so that